नहीं पीछे का है ये। Good evening and welcome to Life with Dr. Shilpi Reddy. And first of all, I wanted to tell you all that I'm very sorry for not being on live for quite some time. There were certain technical issues and glitches that were happening, but now I'm back and I'm so happy to come back into form and join hands in hands with my community and my followers and subscribers. I'm so thankful and grateful to have a community of 1 million and plus subscribers and followers. And I thank both my platforms, YouTube and Instagram, for making me what I am and keeping up to the promise. I would definitely do live very frequently from now onwards, so that all the doubts that are there in your mind, I will discuss in person and we will figure out solutions. Yes, Dr. Shilpi will come live and give answer to every question that you're going to ask. And now a quick hi to Vasavi, Josna, Bhargavi, Anil, and all of you all who have added, who've joined here. And I'm so very happy that today I'm going to interact with all of you all. And this session, especially today, I have picked up all the questions that are there in the backlog, and I would talk about the questions and give you answers, because again we had certain followers who were asking these questions, and I really found them very important, very relevant, and very particularly of significance that we should answer them. And hi everybody, we'll wait for a minute for everybody else to join, and there are questions coming up. Yes, somebody is asking about yoga classes. You can start your yoga classes in pregnancy after about 13 or 14 weeks, because that's when your scan report comes, the first trimester screening. If the placenta is low lying, you do not do exercises, especially yoga and all. So wait for your NT scan and then start yoga. Till then, all your household chores you can do. You can do walking, you can do swimming, you can as well be as much active as possible. And now, for somebody, someone very particularly asked, my age is 34 and how much gap should I take between the first and second child? That's a very apt question. I think it was Rohita who was called and asked about this question. Rohita, for somebody who is 23, we definitely tell them to have a gap of 3 years between each child, or 26 or 28 also. At times we give them a gap of 3 years. But once you cross 30, since fertility rates drop, then we can't have that 3 or 4 years gap between children, because you need to think about your biological clock also. Then what I usually suggest is, since your fertility is going to be at stake 30 plus, you can reduce the gap. You can reduce the gap. And especially for you, specifically you, since you are 34, if you have a normal delivery previously, then you can have a child in less than a year also. If your fitness is good, if your hemoglobin levels are good, if you're healthy, hale, you can have another child as soon as possible. But if you've had a cesarean, then mandatory 1 year gap is important. At least 1 year gap is important, because before you turn 35 again and your fertility rate drops, you should be taking another pregnancy. Now this is for Rohita, and there is somebody by Sai Surya. So there is again Sai Surya, who's asking that her weight is 110 kg and she's 29-year-old and her height is 5'4" and she's having PCOD. How to plan pregnancy? For everybody out there with PCOD, it is mandatory to lose the excess weight that you are having, because excess weight is going to be an issue. It is definitely going to be an issue. And how much of an issue It does not allow egg formation. It does not allow, implantation to happen. It does not allow your fertility to be normal. So it's very, very important that you understand that point and make sure that you lose weight because you're young, you're not even 30. So at this point in time, it is very important to plan weight loss rather than pregnancy. And once you have at least 10 to 20% of effective weight loss, your fertility rate jumps, and that's when you can actually get pregnant easily. So instead of chasing pregnancy, I want you to chase weight loss, and healthy lifestyle in PCOD definitely gives an edge over health, wellness, and your cycles come back to normal. And once your cycle comes back to normal, you will definitely have good fertility rate. And we'll take some questions from water birth good for first pregnancy at 30 years. Definitely, Chandrika, water birth, what I feel is water birth is quite overrated, and there is no much of pain relief inside water. It's only that you might feel a little more comfortable rather than outside. But there are effective methods of pain management for women even outside water. So there is no hard and fast rule that you should have water birth and it's going to help you and all that. But definitely it's one of the methods of having a delivery, and where the effect of water might lighten, little lighten your pain feeling, and it might progress. But it is very, very inconvenient, very, very cumbersome, and it is all messy, and water temperature has to be maintained and all these things. So these are another, little problematic things. And now there's Bhargavi who has asked how to conceive naturally and control PCO, and what are the symptoms of thyroid and PCO. See, Bhargavi, thyroid is a hormone problem. PCOD again is linked to thyroid problem, and it is also linked to prolactin hormone problem. So there are several problems that are associated with the PCO syndrome. Why we call PCOD as a syndrome? Because it is not only a medical problem, again, it is also related to some hormonal imbalances, and there are certain problems associated with hormonal function and all that. So when you have thyroid, your thyroid needs to be corrected first. Your lifestyle needs to be altered. We make sure that you have physical exercise. Yes. Okay. So your thyroid needs to be controlled first for your PCOD to get control. So it is very, very important that you have effective control of your hormonal imbalances when you are with PCO. You do regular exercise, you do, you eat well, you sleep well, your stress is managed. If your thyroid is not controlled, then everything is disturbed, and it doesn't serve the purpose. Now, when it doesn't serve the purpose, your pregnancy rates don't improve, and your weight loss pattern does not improve if your thyroid is not corrected. So it is very, very important. Now, there's another question from Vinita. She's 9 months pregnant. She's having a little bit of white discharge. How is she going to deal with that situation? You're 9 months pregnant, Vinita, and in 9 months pregnancy, you will have that little bit of discharge, and you might have a little bit of brownish discharge, pinkish discharge, and you might have a mucus plug. You might have little bit of irritation also. All that what you have to do is, if you're not having any itching, nothing to worry. Minimal discharge is still fine, nothing to worry. If you are having some itching, irritation, and all that, bad feeling and foul odor, go for a vaginal examination, check for any infections, make sure that if there is infection, get it treated, and make sure that if you have any kind of symptoms, it can be fungal or bacterial infections, you can take care. If there is nothing of that sort and you're checked and everything is fine, it's just discharge from the cervical ripening and the head coming down, and just to facilitate the ease of labor, there are certain changes that are happening, and you should not panic. And Pavitra is asking tips to follow when the placenta is down and for subchorionic hemorrhage. Now, Pavitra, when the placenta is down, that means usually placentas are above. That is called fundal placenta when it is on the upper side of the uterus. It is on the lateral side, I mean on right side and left side it is called lateral. If it is behind, then it is posterior. If it is in the front side of the uterus, it is called anterior. All these positions are normal. But if the placenta is down, if the uterus is like this and the placenta is down, it is called placenta previa. That means the blood supply is near to the gravity. So it can have little bit of bleedings, it can have little bit of discharges, brown discharge and specks of blood. But you have to be very, very careful, because you should not travel much, outstations and all, no intercourse and no lifting heavy weights, and do not exert yourself. Stress also is one of the marker that you should really stay away from. And when we talk about subchorionic hemorrhage, subchorionic hemorrhage is bleeding just behind the future placenta, because chorion is something that is the outer layer of the pregnancy and placenta and all that. If there is a small bleed behind that in first trimester, first 3 months, these kind of bleeds are quite common, and you should not panic when you have a bleed. You should go to the hospital and consult your doctor, and your doctor will give you some additional medication, some kind of injections at times to support the pregnancy and do not allow it to further escalate and become more bleeding. And the most important thing at that moment of time is not panicking. The most important thing at that time is reaching out to the hospital and doctor and taking that first aid medication. That first aid medication is very, very important in building up your healthy pregnancy. And subchorionic bleeds happen. There are some normal subchorionic bleeds and there are some abnormal. Abnormal, as I told you, the placenta is low lying. You can have an abnormal placental bleed behind the placenta. Sometimes, if how does placenta form? It just bores into the uterus and blood is sucked into the placenta. So this kind of making a hole by the chorionic villi which enter into the placenta and take the blood supply. During that process, a small vessel is damaged and a small collection is seen, and that is seen outside. This is physiological and it should be different from from abnormal bleedings. So that is very, very important. And Chandu is asking that 2 IVFs have failed right now and I'm going to ERA test. How much chances are there for ERA test? Chandu, see, what is ERA test? ERA test is endometrial receptivity assay. Now, endometrial receptivity assay means when they have done 2 transfers into the uterus, that means 2 IVFs they have done, and they have transferred the embryos. Why did the embryo not stick into the uterus? They want to know that reason. Okay, that reason is endometrial receptivity assay. Now, how do we know that reason? When you don't transfer the embryo in one cycle, that means we do a test cycle, and they will check the biopsy. They'll take a small biopsy from the endometrium and check whether that was the right time for doing the transfer or not. If the biopsy says you should transfer 6 hours later, that means whatever transfers that were done, that was not done in the right time. You have to transfer